Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey. She's a physician advocate. And we welcome Geoffrey Roche. He's a healthcare consultant. The KevinMD article we're talking about is the duty of health system boards to prioritize organizational culture, workforce development, and career pathways. Kim and Jeff, welcome to the show.
Thanks, Kevin.
Kim, how did you find Jeff? And what about his story resonated with you to bring him on kevinmd.com?
We connected on LinkedIn a while back this
Oops.
summer to have Geoffrey on with Dr. David Morris on my Stand Up for Doctors YouTube channel. And during our conversation, Geoffrey posed this pivotal question: where are the boards? Where are they to care about these issues? And that was like a mic drop moment for me, because of all the conversations I've been having in this space for a couple of years. Nobody ever mentioned the boards. So after our conversation, I'm like, this was so awesome. And I wanted to talk about it more. And I wanted this conversation to have a bigger audience. So I was like, I have an idea. Do you guys want to write an article? And David at the moment did not have the bandwidth, but Geoffrey was like, sure. And so we did it, and here we are. But I do want to tribute Dr. David Morris and his wife, Olivia Morris, who you've already had on,
Yeah.
for their insights and contributions to this topic.
All right. So, Jeffrey, tell us a little bit about your story, and then you could lead into your article for those who didn't get a chance to read it.
Yeah, so obviously, Kevin, thank you, and Kim, so appreciative of you and all the work that you do in this critical space. My story, obviously, is the son of a nurse. Entered hospital administration back in 2008. Served in hospital administration at a healthcare system in Northeast Pennsylvania from 2008 to 2017. Moved on from there after we were acquired as a system and moved into academia, actually, and did similar work in the academic world. Always was involved in leadership, workforce development, partnerships, and such. While I was in healthcare, worked for a great CEO who happened to be a nurse, and I learned a lot from her actually during that time around boards, because we had a very interesting board, and ultimately I tell people our board is what led to us being acquired and ultimately led to a lot of things afterwards that were not right for the community. And now I have the privilege of leading workforce development in North America for really focus on US and Canada for Siemens Healthineers, and obviously do a lot of other ecosystem work in the healthcare and education sector.
All right. So, Jeffrey, tell us the role of healthcare boards, whether it's for an academic facility, a hospital. For those who aren't familiar with healthcare boards, tell us about who they're comprised from and what their roles are.
Yeah, so obviously in the healthcare system in the US, we've got either for-profit or not-for-profit. And so in a for-profit situation, obviously they have shareholders of the board. So if you think of organizations like, Tenet, HCA, those types of healthcare systems are going to have shareholders. The not-for-profit, which is the larger share of our healthcare system, have usually boards of directors or boards of trustees. And they generally are governed by themselves, generally, are to be representative of the community. And generally, though they do not necessarily, in a most significant way, have healthcare experience, most cases, the chief of staff or the medical staff or the president of the medical staff, which happens to be a physician, does serve on the board. But other than that, there's usually very, very few actual clinical people with actual clinical experience on the boards. And these boards ultimately are responsible for hiring and firing the president and CEO of the system. And they're also responsible for all aspects of what they call fiduciary responsibility. And fiduciary responsibility goes as far as finance to strategic positioning of the organization. I argue, and this is what Kim and I argued in our article, that it actually goes a little bit farther than that. So, ultimately, you don't have healthcare finance, you don't have healthcare strategy if you don't have people. And so culture, people, recruitment, retention, career pathways, thinking about your actual workforce, caring for them as your workforce is super important. And, Kim and I argued that, and we'll continue to argue, that boards should take ownership of those issues. And they should actually hold both the president and CEO and the executive team, responsible and accountable. Because when we talk about burnout, I'm sure you're familiar with the nurse Tristan story. The nurse Tristan story, which went public, sometime last year, is a very sad situation. A nurse in Ohio worked for a healthcare system in Ohio, and ultimately the burnout was so bad that ultimately led to the ending of her life. And her parents found that article. She wrote a letter to the editor herself prior to her passing, And her parents found that and published it. And it's a very, it's still found, you can find it today. It's an emotional article to read. But when you read it, what you see is, a healthcare system that ignored what she was facing, leaders that ignored exactly what she and others were experiencing. And those types of things, in fact, I had posted that article, that letter to the editor on LinkedIn when I saw it. And one of the things I said was, when will boards wake up to the reality of these situations? And when will they say to the executive team, you need to own these things, or else we'll hold you accountable? And to me, this is truly decisions of life or death, as this case points out. And as somebody that's worked with boards in the healthcare system and such, I just think there's a lot of work we have to do to truly make them representative and more effective in this case.
So, Kim, of course, it's well known. You talk to so many people across the healthcare spectrum about wellness, about burnout, and you're certainly doing your best, and you're doing so much to help combat that. Now, before talking to Geoffrey, what did you hear about the role of hospital boards or academic institution boards in terms of influencing burnout, either positively or negatively?
I didn't. And that was the thing. Nobody was talking about boards. Doctors don't mention boards. And I'm going to take a little pivot to share that when you just said that, what I'm thinking of is, in our last conversation, you would ask me when I talk to doctors about AI, like, what are they saying about AI? But when I talk to doctors, they aren't talking about AI. Like, doctors are talking about the human things, their human struggles, and things like that. They're not talking about boards, and they're not talking about AI in our private conversations.
And Kim, either as a patient or as a physical therapist, there was no visible influence or interaction that you had with the boards of the various healthcare institutions or hospitals that you dealt with.
Correct. And I was thinking, when we get off of this call, that I'm going to send our letter to the editor, and I might send it to our hospital.
So, Jeff, what kind of influence do the board have? Like, what kind of power do they have, or what can they do? Like, we're talking about burnout specifically and how they need to take more of a responsibility. But in practical terms, what practical things can hospital or medical institution boards really do?
Well, I mean, think about it from the vantage point that the boards make the ultimate decision on the firing and hiring of a CEO, but they also have influence over the rest of the executive team. And generally, the executive team and leaders of the healthcare system, including physician leaders, serve on the board subcommittees. And so, if you think about medical executive structure of medical staffs, as you heard me say, the president or the chief of staff of the medical staff generally is on the board. One of the things I also argue is that there should be a nurse on the board. Every health system should have a nurse on the board. And the reason is it's the largest workforce in a healthcare system. And so I'm not arguing that a current nurse necessarily be on the board. I think there's a lot of good discussion, that could be held there. But if there's a current doctor on the board, why can't there be a current nurse? I think that's a fair argument. But there should be somebody that represents that. Now, in terms of what they can do, look, they set the policies and the standards and the strategies for the healthcare system. They're the ones that have to look out 10 years, 20 years. And I don't think you can look out 10, 25 without dealing with your current climate. And so I do believe fiduciary, I'm not suggesting that boards should micromanage, but I do believe that it is fair for a board member. In fact, I serve on numerous boards, not a health system board because I couldn't because of a conflict of interest right now because of my role. But I do serve on not-for-profit boards, and I think it's fair for a board member to be asking questions about culture, asking questions about burnout, asking actual data. And I'll go so far to say, if I were on the board, I'd be asking to meet with that staff. I want to hear from the staff directly. In fact, when I was at my regional community healthcare system, for many years, we had board members, including our chair, who happened to be a president and CEO of a local bank, who was a phenomenal chair. And he would meet with staff. And if he didn't meet with staff, his wife would meet with staff because she was well known in the community. And guess what? He would bring issues to our CEO and she would deal with them. And, she never saw it as micromanaging. She saw him as her governing partner. And that's what a board is about. It should be a governing partner to the president and CEO. But to do it effectively, the board needs to be in touch with the workforce because ultimately they also are responsible for them. And so to me, it's a human-centric model. You've got healthcare systems are large workforces in a community. Generally, these boards are made up of leaders in that community. I don't know how you could sleep at night
Mhm.
and be a CEO of a bank or be a CEO of a grocery store or something else and know you have burnout, stress, really bad culture occurring, and you're making decisions, but you're not actually thinking about the people. That to me is just, it's just crazy.
And Jeffrey, is that typically not happening on from what you hear or what you see on LinkedIn in terms of a typical hospital board? Do they not have that nurse? Do they not have that connection with the staff? What's typical out there?
Well, less than 3% of our nation's boards have a nurse on them.
Mhm.
So, I mean, that tells you right then and there. The other thing that I know Kim and I and David talked about when we had this discussion is also the boards generally are not representative of the community they serve. So, for example, most health system boards are still generally dominated by white male,
Mhm.
generally older gentlemen. They're not necessarily having the diversity that is really important, to really truly represent the community. You could go so far to even argue, and I would go so far to argue this, that if you had a board that was more comprised of the community, we may also be able to move the needle with health equity because they would be asking more challenging questions on the quality committee, on the patient safety committee. And so we have a lot of work to do in this space. Same thing goes for even having more gender diversity on these boards. Like we can't continue to, have a healthcare system. I mean, women dominate the healthcare workforce, but yet they're not fully represented on the board. And so I look at it from the vantage point of, I know, we're at a time where people don't want to really talk about DEI, but the reality of it is in healthcare, you can't get away from it. It is truly about advancing health equity and truly advancing a culture where everyone matters, feels recognized, appreciated, and valued. And so we have a lot of work to do with boards.
How do boards typically include new members? Like how are they typically voted in?
So typically, there's a governing process, and generally, at least let me say on the not-for-profit side, which is where I'm more familiar, they generally are selected from a pool of people that they know. And so, it's not generally an open to the process community
Hmm.
situation. Now, there are some boards where they will do that, where they'll send out a letter to the newspaper, welcoming individuals to submit their applications. And then, the board governing committee, for example, may, vet them, talk to them. The president and CEO also generally is asked to think about people who may be good for the board, may interview them, prepare them. I would argue that, and for example, when my former system, our CEO was a woman and she was a nurse. And one of the things she was seeking to do when she was the president and CEO was intentionally to diversify the board.
Hmm.
And so it was during her tenure, for the first time over 101 years, that a woman got on the board. I mean, think about that, right? 101 years of a healthcare system, first time a woman got on the board. Also, the first time an administrator from higher education got on the board because she said, why wouldn't you have an administrator from higher education? The provost from a local community college. And then the third was she specifically went out and looked for a leader of color because she said, we can't continue. And so in her case, she had a board chair who also shared this. And so she was able to work with that board chair. So the president and CEO has significant influence. Now, here's the thing, Kevin, right? Think about it. If the president and CEO is ignoring the culture and these issues,
Hmm.
and the board chair isn't really thinking about it, then you see why we're in this because the board really comprises of itself. Generally, I hate to use the word like inbred, but in many ways, it's kind of like that. And so think about it from this vantage point. If I were in a region where Kim lives, she's a perfect health system board member. Her health system should be calling her up today and saying, hey, Kim, what would it take for us to have you serve on the board? Because not only would she have fiduciary, but she would be thinking about the people part. And she's also a clinician. And so, these things is why it's important. We need to have people who actually understand healthcare on the boards, and we need to have people who understand why people matter.
So, Kim, after having this conversation with Jeffrey and David and knowing the impact and influence of hospital boards, how is this knowledge now informing your conversations when you talk to other healthcare professionals about burnout or on your own podcast, knowing this influence of hospital and nonprofit boards?
Well, I'm going to make sure that this speaks to the title, what I called our episode, and it's always keep people at the center. And it all boils down to that. You need to keep people at the center. And if we would just do that, a lot of the other issues would fall into place.
We're talking to Kim Downey, and Geoffrey Roche. Kim is a physician advocate. Geoffrey is a healthcare consultant. We're talking about the duty of health system boards to prioritize organizational culture, workforce development, and career pathways. Now I'm going to ask each of you just to share some take-home messages with the KevinMD audience. Kim, why don't you go first?
Sure. And I did want to speak to the human connection and to share that I got to meet Geoffrey in person and give him a hug at the Burnout Symposium last month. And then David and Olivia Morris went from LinkedIn Connections. So we spent 2 weeks in Ireland and spent 2 days with them and their family. So we are really it's all about the human connection and, supporting each other. So what I would like to share is a few more messages from that episode that I featured David and Geoffrey in. And what David said is what we really need is people to start coming forward with solutions, driving with action, changing the culture, actively being on the ground and doing it. And Geoffrey added, what I've always been reminded of is the power of relationships. There's nothing like a human-centered relationship, and I think that's what in many ways we've missed in healthcare, and it's become larger, and it's what we really need to get back to, the human-centered connection. And then when Geoffrey was speaking to health equity, David responded, each one of those people is a person with a story that needs to be cared for, that needs to walk out the door feeling like they've had care. They've been able to heal or get something done that makes them better. It's not a widget factory, and we need to bring healthcare away from that. And what I want to add is I say we need to include doctors, and doctors are also people with a story that need to be cared for. Doctors need to walk out the door feeling supported and feeling like they're able to make the difference they went to school for at least a decade of their lives to make. And you've mentioned more than once, Kevin, during our recordings that some of these issues have been discussed by your guests for years at this point. And I feel like the ripples and waves are primed for a tsunami, hopefully of the good kind, for changes in healthcare. We need action, and I'm going to be a part of it. And I'm starting a group discussing patient empathy and clinician well-being. And regardless of insurance or other obstacles, we can make a huge positive difference right now when healthcare leaders put the well-being of their staff first. And when that becomes the top priority, as I said, other things will fall into place. We need a lot of support to make these changes. So please reach out to help make a difference, and you can find me on LinkedIn.
And Geoffrey, we'll end with you. Your take-home messages.
Yeah, I always say healthcare does take a village in a community. And, I think to Kim's point, we really have to rally together and truly engage with all aspects and all facets of the healthcare ecosystem. And, my take-home message really is, if you're serving in a leadership role at your healthcare system, or you're serving on a health system board today, look around you and truly study. Do you have a board that's representative of your community? Do you believe the voices of the employees are being heard at your board? Is your executive team listening to those voices? Are we taking the time to hear those and learn about those human connections? To Kim's point, when we do, we see really positive change happen. And lives are literally at stake every waking moment, unfortunately, right now in our US healthcare system as we speak. And we have to demonstrate respect, compassion, and empathy for the incredible doctors, the incredible nurses, the incredible clinicians, and all of the staff, both non-clinical and clinical, in our healthcare system. And I think boards have an important responsibility to do that. And again, Kevin, I applaud you and Kim for being, not only pioneers, but, incredible voices in this quest. And I'm happy to be here along with you.
Kim and Geoffrey, thank you so much for sharing your perspective and wisdom. And thanks again for coming on the show.
Thank you, Kevin, as always.
Thank you.